news report from MHA News. MHA News stands for Mental Health Awareness News, and we report different mental health issues that many teenagers experience, spread awareness of it, and how to help those that are suffering from these disorders. Hello, my name is Mana Matsumoto, and I'll be exploring some common mental health problems with you today. Today, we are going to be talking about a mental health disorder that is troubling many people around the world. Schizophrenia. Schizophrenia is a type of chronic brain and mental health disorder that has started to become well known as many youths are experiencing this disease. This particular mental health issue makes it emotional and lose touch with reality, which leads to some of the common symptoms being hallucinations and delusions. Today, we are going to be joined by two specialists on mental health disorders, Dr. Yule and Dr. Prasad.
Thank you, Mona. Hello, I am Dr. Prasad, joined by Dr. Yule to explain the mental health disorder schizophrenia.
So, Dr. Prasad, can you explain further about what schizophrenia is?
Sure, Mona. Schizophrenia is a type of chronic brain disorder that affects 1% of the population of Canada. Now, 1% may not seem like much, but it's actually worth approximately 380,100 people. The incidence of schizophrenia is rising dramatically in adolescence, and its prevalence is estimated at 0.23% in the age between 13 and 18 years. Research shows that young adults aged 18 to 25 years old have the highest chance of getting schizophrenia.
Wow, but how can we tell if we don't have this severe mental health issue? Are there any signs we should look out for? Well, you can normally tell if you have schizophrenia if you show some of its symptoms. The most common symptoms are confusion of speech, suicidal thoughts, confused speech, thoughts of hallucination, delusion, troubled thinking, lack of motivation, overly excited, lack of emotional expression, and temptations to do drugs or alcohol. Those are some very serious symptoms. What can cause such an issue to occur?
Well, the exact cause of schizophrenia is unknown, and it is believed that a few combined factors led to this disease. The first one is genetics. This mental health disorder tends to run in families, but no single gene is responsible. It is more likely that different combinations of genes make certain people more vulnerable to schizophrenia. However, having these genes does not necessarily mean that you will develop schizophrenia. A common mental health issue, stress, can also lead to schizophrenia. Research proves that stress during vulnerable development stages in childhood can lead to the disease. This means that children who have high stress and anxiety are more likely to experience schizophrenia. Brain chemistry can also greatly contribute to this disease. People who experience schizophrenia normally have an imbalance of brain chemicals or neurotransmitters, which are molecules that are used by the nervous system and pass messages between neurons, such as dopamine, glutamate, and serotonin. The imbalance of these chemicals affects how people's brains react to sensory information like loud noise and bright lights. These problems of processing sounds, sights, smells, and tastes can lead to the symptoms of hallucinations or delusions.
Some other possible causes of schizophrenia: complaints during and before birth, childhood trauma, and preventions and before using drug use. Complications that took place during and before birth, such as low birth weight, infections during pregnancy, and not getting enough oxygen during and early birth, make some individuals more vulnerable to mental health disorders, including schizophrenia. Experience of traumatic events during childhood may also complicate to develop schizophrenia. And finally, use of drug use as marijuana, cocaine, LSD, not cause schizophrenia. Although research has been proved these types of drugs can lead to symptoms of diseases those are more at risk. And is there any possible way to prevent all this from happening? Currently, there is no sure way to prevent schizophrenia, but there are some ways that can possibly prevent from getting worse. Tell a doctor if anyone in your family has ever had it, so you know what to do. Follow the medicine and treatments your doctor gives you to stop worsening symptoms. Learn about this disease and the risks so you can realize if you have it early on and get earlier treatment. Learn about the symptoms. Therefore, if you have any, you know to get help right away. Some treatments you can take are medications your doctor tells you to, doing physiotherapy. Sorry, it's actually psychosocial therapy. There are also some teams of people who can help you. There are physiologists. These words are really giving me trouble. It's psychologists, social workers, physiatric, psychiatric, nurses, and managers to coordinate care. Very interesting. But it seems that people with schizophrenia have a very hard time recovering. I wonder how the last people with schizophrenia...
Actually, Mona, I would like to tell you about someone who has been suffering from schizophrenia since they were 14 years of age. Could you imagine losing touch with reality at only 14 years old? From a young age, even before she got diagnosed with schizophrenia, she heard voices and saw many different animals and insects come and disappear without a trace. And some things she does to help treat her schizophrenia are getting help from her therapist she already has been visiting. She had to go through rehabilitation therapy, learn how to read again, and needed help to regain her social skills.
Thank you, Dr. Prasad and Dr. Yule. So much, but unfortunately, the end of our report has come. Thank you both for helping us explore mental health with us today, and I hope you all have an enjoyable day. This is Mana Matsumoto signing off.